Hi, Dr. Susan Claney here, and today I'd like to talk to you about the importance of methyl groups. Did you ever wonder why all of a sudden someone develops a neurodegenerative disorder, heart disease, an autoimmune condition, or even cancer? Did it just drop down out of the sky and land on their head? Absolutely not. They expressed a bad gene. How do you express bad genes like autoimmune, MS, ALS, Parkinson's, heart disease, or cancer? The answer lies in depletion of methyl groups. Depletion of your body's methyl groups is how bad genes are expressed. How are methyl groups in our body depleted? We deplete them by consuming a poor diet. A poor diet loaded with white sugar, white flour, white salt, bad oils such as trans fatty acids and hydrogenated oils. We deplete them by eating produce loaded with pesticides and herbicides, junk food, drinks loaded with caffeine, high fructose corn syrup, genetically modified foods, and stress. All these things deplete our minerals and deplete our body's ability to methylate. So what helps create methyl groups? Well, one thing is hydrochloric acid or stomach acid. That's why it's vital for everyone to have the proper amount of stomach acid. We create massive amounts of stomach acid when we're young, but as we age, we make less and less. Again, further decreases in stomach acid, or HCl, are caused by excess stress and, again, that poor diet, that standard American diet. Methyl groups are vital for normal cell replication at the level of the DNA. This is really important. I'm going to say it again. Methyl groups are vital for normal cell replication at the level of the DNA. They literally turn genes on and off. When you've depleted methyl groups, bad genes like cancer-causing oncogenes are turned on, and the good genes like cancer-preventing tumor suppressor genes are turned off. When you have sufficient methyl groups, good genes like the tumor suppressor genes are then turned on and protect you, and the bad genes like the oncogenes are turned off. So methyl groups are vital for phase 2 liver detoxification as well. They're vital for protein methylation. They're vital for homocysteine breakdown and metabolism. Increasing the methyl groups decreases inflammation. I'm going to say that one again too. Increasing your methyl groups decreases inflammation. Increasing methyl groups increases neurotransmitter synthesis and nucleic acid synthesis. You may not know what those things are, but those are good for you. Inadequate methylation capacity can lead to birth defects, depression, cognitive decline, diseases, and cancer. Impaired methylation has even been associated with autism. So, a patient has a depleted methyl group or depleted methyl groups, and all of a sudden they come in contact with a toxin, maybe some prolonged exposure to electromagnetic fields, a dental infection, or maybe even a severe emotional stress like a divorce or something. And then, bam, they express the bad gene. The next thing you know, they have a neurodegenerative disorder like Parkinson's or Alzheimer's. They have an autoimmune condition or maybe even cancer. None of these conditions drop out of the sky and land on a patient. There always has to be a cause. And the cause is often associated with depleted methyl groups. So, how do you test for adequate levels of HCl? One way is by checking the patient's blood work and looking at total protein, serum globulin, BUN, and phosphorus. If some or all are abnormal, you most likely have lower levels of hydrochloric acid. Some of it is also based on symptomology too, but that's how you test through lab diagnosis. How do you test for methyl groups? There's a specific urine test that can be run called the basic organic acid test. And that will let you know too, are you low in methyl groups? So, how do you increase hydrochloric acid? Well, you can watch my video titled The Importance of Stomach Acid for Everyday Ways to Boost Your HCl. But here in this video, I'm only going to refer to one of the easiest ways. And one of the easiest ways to increase hydrochloric acid is by using supplements. They're relatively inexpensive, and using supplements to increase HCl in the stomach is one of the best means of preventing serious illness. Many patients cannot tolerate HCl directly in the beginning because their stomach acid is so low or their stomach is inflamed. and not producing its own stomach acid. You may have to soothe the gut first before adding in HCl. So I use a product from Premier Research Labs called Gastrovin as a tea. You use 2 or 3 capsules in hot water. There's other ways you can do it as well. But taking hydrochloric acid after a meal should be something that everyone should be doing after the age of 25. Or you can see my other video about natural ways that you can add hydrochloric acid back into your diet. So up until the age of 25, you can use pink sea salt, and that will often suffice to produce hydrochloric acid. Throw away the blue container of white garbage salt, put it in the trash. Pink sea salt is not chemically processed like white salt, and it contains calcium, magnesium, and a multitude of other trace minerals that your body needs and requires. The body will then take the chloride molecule from the pink salt and it'll make hydrochloric acid. No matter what age, using pink salt is one of the best things that you can do to improve your health. But please note that hydrochloric acid breaks down food, but by itself, hydrochloric acid cannot methylate a cell. You need other minerals to do that, to help methylate. Potassium being one of them, and you can add potassium in, and that'll create trimethylglycine, and it's the trimethylglycine that will add the methyl group to each cell. Methyl is part of an acetyl group in chemistry. Again, deacetylation occurs in cancer. So if you don't have enough stomach acid and you don't have HCl, you don't deacetylate very well. It was Dr. Stanislav Burzynski that first showed that deacetylation turns on oncogenes and turns off tumor suppressor cells. Acetylation occurs when we add methyl group to the chemistry mixture, and acetylation turns off oncogenes and turns on tumor suppressor cells. Kind of as a side note, patients that wake up in the middle of the night and are unable to fall back to sleep usually have a problem with their stomach. They may suffer from hypochlorhydria or low HCl. Patients that have difficulty falling asleep at night usually suffer from a gallbladder problem, and feeling groggy in the morning may indicate an adrenal or energy issue. Finally, I strongly recommend that patients do not drink alkaline water, as it will alkalize their stomach. It will alkalize their stomach and not their body. You want the stomach acidic, not alkaline, so it can digest your food and create those methyl groups that are so important. I have had patients that have drunk alkaline water for years and years, and when we check their morning urine pH, they're very, very acidic. They've depleted their body's methyl groups due to a lack of stomach acid. So it's important to have adequate stomach acid, and if you do not have adequate stomach acid, you're not going to be assimilating your nutrients very well, which will predispose you to chronic illnesses. If you have any questions, please email me at susanclaney@gmail.com.